All right, welcome back to Morning Live. And right now, I want to focus on health issues in this country. Let's leave alone nurses strike, what's going on. But we want to talk about now the tropical situation. Now, in studio, I'm joined by Mr. James Nsongo from the Kenya Red Cross. He's a nutritional and, of course, social? Public health, and of course, Mr. Sultani Matendechero from Ministry of Health. He's actually from the Neglected Tropical Diseases. He's the National Programs Manager, and they're here to talk about what has been happening, the progress so far, and of course now what is happening on the ground. Because as we are here just trying to talk, there's so much happening on the ground. Now, I'll start with you, Mr. Sultani.
It's Dr. Sultani.
Dr. Sultani. Whoa, interesting.
Right.
Thank you for that correction.
Yeah.
Thank you so much, Dr. Sultani. Of course, I'll remind you, he's the National Programs Manager and Neglected Tropical Diseases. So, when you talk about neglected tropical diseases, there's so much happening in just in terms of trying to get the awareness. Not so many Kenyans are aware that some are neglected, because it's actually detrimental to so many people in the fact that there's no idea or education in terms of just enlightening Kenyans on what's happening.
Yeah, actually that's true, because when you talk about the neglected tropical diseases, we abbreviate it as NTDs.
NTDs.
So you'll hear me talk about
NTDs
absolutely. A lot.
Now we know.
Yeah, so generally what happens is that these are diseases which mainly affect poor people, because you'll find they're related to things like water, sanitation, and then some of them are generally because of the lifestyles of the poor people.
Okay.
Yeah, so not so many people are interested in developing tools and interventions that are going to address the diseases, because there's no return on investment.
Okay.
So generally what happens is that, you know, these diseases are neglected, the patients or the people who are suffering from them are forgotten, and so they just suffer in silence. And mainly what we need to do, and you got it very right, I'm actually impressed, what our main mandate is to create awareness, to be able to expose that these diseases are killing people, they are disfiguring people, they are causing a lot of social stigma, and they need to be given attention.
Sure.
Yeah, so generally we have about 20 diseases which are listed as neglected tropical diseases, but in Kenya there are just about 12 that are of public health importance. So those are the ones that we are focusing on in Kenya, out of the 12 that have been listed by WHO. Yeah, and right now we are zeroing in on 4 out of the 12.
Sure.
Because yesterday we actually just launched our breaking transmission strategy for soil-transmitted helminths, which are usually called intestinal worms. Bilharzia, you know, which is also called schistosomiasis, and then there's also lymphatic filariasis, commonly known as elephantiasis, if you've seen people with swollen legs, and then trachoma, which actually blinds, causes blindness.
And I think it's big. Trachoma is big, actually.
Yeah, it affects quite a number of people, millions of people actually. So we are having a strategy where we want to be able to address these 4 diseases, you know, in one integrated approach, so that we can eliminate them from the country within 5 years. So right now we are actually now just in the thick of things when it comes to the breaking transmission strategy.
Interesting. James Nsongo from Kenya Red Cross now, when you see Kenya Red Cross also partnering with the Ministry of Health, that's quite something. It means now the severity of this issue is not actually something to joke with. Now, as Kenya Red Cross, how have you now made sure this now is being contained?
Oh, great. Thank you very much for this opportunity. I think the partnership with the Ministry of Health as Kenya Red Cross is very strategic. It's strategic in the sense that particularly on the control of neglected tropical diseases, you see, we've been part of the development of the national strategy, the breaking transmission strategy, with support from our partners, Children Investment Fund Foundation. We got some funding, and this helped us now in the thinking that Dr. has talked about. Think about a framework that can lead us into breaking the continuous transmission of the said diseases. Given the fact that there's been a lot of interventions, but they've been fractured, and therefore we needed a better coordinated approach to breaking transmission, stopping further transmission, even as we manage the existing cases. And the partnership at that level has been to develop a document that will work, both of us together, with other partners, of course, and ensure that we approach these neglected diseases from an angle of ensuring that we actually eliminate them. And I would say that it's at policy level, because at national level we work auxiliary with the national government, and at the county level we work with the county government. So Kenya Red Cross finds itself in a position that is very strategic to both support national government, Minister of Health, to develop the policy document, the guidelines that are required. And critical is the fact that moving to the counties, our presence, you are aware, is very much there. Our teams on the ground will support now implementation of the strategy. Yes.
Now, when you talk about the poor lot, let's just put it as it is, less fortunate, and the tropical disease, the neglected one, actually now attacks them big time. Do you think now the social welfare also, and of course the economic situation, plays a big role in this? And as far as we're trying to focus on a disease like, let's say, elephantiasis, this is something that's been affecting. Okay, it's not so big in Kenya, but still one of the mentioned diseases. So what is being done to actually now make sure, it has zeroed in on these people who are less fortunate, let's say the poor? What is being done now to make sure these things are now being reduced?
Okay, so there is a package of interventions that have been recommended by the World Health Organization and the NTD community in general. Which can actually, if implemented properly and efficiently, we are able to mitigate a bulk of these diseases. And it is actually envisaged that within a certain time frame, depending on how well you implement these public health interventions, then you expect, actually you can even plan for the kind of results that you'll be able to achieve within that time frame. So one of the strategies is implementation of mass treatment of communities, because these are not people who will come and seek treatment in the hospital for fear of not being able to afford the treatment that will be provided to them. So we go into the community, we conduct surveys, we determine the burden of disease in that particular community. And if we find that it is at a certain level, we go in and just treat everybody in the community. Because most of these diseases are transmitted from one person to the other in a certain way. So you'll find maybe some are transmitted through mosquito bites, some are transmitted through flies like trachoma, some of them are transmitted through, like when you, the orophycal route, when somebody maybe like defecates or relieves themselves in the open, and then it rains and the eggs of worms go into the river and another one drinks, then it's a situation where the whole community is at risk. Even if you are not sick today, tomorrow you'll probably be sick. So we target the whole community and we call it preventive chemotherapy. So as we are treating everybody, we are treating the ones who are infected, but at the same time we are preventing the ones who are not infected from being infected. That's number one. Number two, we are also looking at a provision of safe water, because most of these diseases are related, they are water related. Where there is no water at all, or where there is water but it is not safe, then you find that the diseases are prevailing a lot. So it is an issue of making sure that there is safe water to all, so that it is available and the transmission is mitigated. Number three is about behavior. I just talked about people going for long call or short call in the open or in the rivers. So you find as they are swimming, they are urinating in the river and shedding eggs of bilharzia, then the person who's downstream is also swimming and they get infected by this same disease. Or maybe shedding eggs of the intestinal worms, and the person who's downstream now taking the water for domestic use ingests the eggs and they are infected. So we want to now start addressing these behaviors through behavior change communication, which is a major intervention that we want to be able to take care of. And then number four, I said that there are some insects that are able to transmit, like elephantiasis. It's transmitted by a mosquito. So we also want to address, we call those insects vectors. So we want to try to address those vectors through, integrated vector management. So that as malaria program is providing mosquito nets, we also try to see how we can benefit from it and prevent the spread of elephantiasis. Now the last intervention is regarding animals, because some of the diseases, whereas they affect the human being, these neglected diseases, you'll find that they also affect animals. And now it becomes something
some
that,
cycle.
yeah, if we cannot just treat the human being alone, because the animal is a reason.
We will consume, of course.
Yeah, so now we also pay some attention to the veterinary component, which we call zoonotic diseases.
Okay.
So there is also the aspect of neglected zoonotic diseases. So if we now implement those 5 strategies, then we have a very good chance of making sure that these diseases are eliminated from the community, without people really having to come to the hospital to seek this kind of interventions.
Okay. Now, James, as Kenya Red Cross, it's all about being on the ground.
Exactly.
Now, hands-on, you're the people who see the real things happening. And Daktari, of course, who've been there also, but you see, most times, you're the people who actually go on the ground. But when you look at the situation so far, do you think it's being handled well? And of course, as Kenya Red Cross, understand you've seen it all. And you can actually measure the severity of all these things, how it's affecting people. Daktari has mentioned from the rivers, just some sort of carelessness. Also, as Kenya Red Cross, are you doing something not to educate the public not to be doing such things? Because now they're the key causes of all this. Of course, the vectors, we can't really avoid them. The mosquitoes, yeah, there's control mechanism, yes. But are you doing something now to make it now a public awareness situation here?
Oh, great. Kenya Red Cross is the biggest humanitarian organization in this country. These are the challenges that we encounter on a daily basis. And somehow we have a story to tell with regard to the vulnerable communities, vulnerable populations that we find who are in this particular environment, as already explained by Daktari. You realize what he's actually talking about is interventions that are around the package of primary health care. And primary health care is a whole concern of what we do, what the Department of Health and Social Services have been, our approaches are aligned to that. So when we are working with the county governments or have projects at the community level, our approaches actually address these issues of sanitation. They address issues of success. Recently, you saw Kenya Red Cross as part of the team that we have now trained a number of community health workers, community health volunteers in Tharaka Nithi, for example. Same is happening in Bomet County that we are about to launch tomorrow. The whole system is about health strengthening strategies to ensure that the community health functions are strong enough to respond to issues prevention. And our presidency has a story around how many such cases are present and what is it that we can do. And because we are very close to the households, then we find these things very necessary for us to have it. In the global agenda of universal health coverage, we have to address these issues because we are talking about not leaving anybody behind. Then these are the categories of people who are affected with or by some infections that we can actually prevent. So we are involved and involved in supporting the government, strengthening the human resource, and ensuring that we add to close the gap on the human resource involved by training a number of community health volunteers we can support, working with the county government, and having projects and programs that are integrated to address the vulnerability of groups at the household level. So it's a whole way of ensuring that we reduce the vulnerable groups who are subject to this.
Interesting.
Yes.
In public health, I understand the theme is always prevention is better than cure. One of the main drivers of the operations in public health. And Daktari, what can you tell us about now the preventive measures? Of course, we have the vectors. We have all these people now, as you mentioned earlier, that people who are now careless in one way or another, urinating in the rivers. Prevention part. What is being done by the ministry just to ensure now they are minimized in this situation?
So I think apart from the interventions that I talked about, which you'll realize that there's a very strong component of prevention in them. In the interventions themselves, like even the mass drug administration that I talked about. We ourselves, we call it preventive chemotherapy.
Absolutely.
Because there's a big component of
that.
utilizing the mass drug administration to protect those who are not yet infected from being infected. That in itself is a preventive measure. And as you have correctly said, for us, we prefer prevention you know, as opposed to waiting for the people to be infected so that they come for treatment. Although we also treat those who are infected. There is a component that we call case management, or we call it intensified disease management. So that when we detect, like someone comes to the hospital and we find they are sick with an NTD, we know that this is something that can be spread to other people. So we follow them to their homes, and we do now something called active surveillance. So there is the passive surveillance where the person comes to the hospital, we diagnose them, and then we now go out and look for those who might be infected, who have not come to the hospital, and that component we call it active surveillance. And then of course I talked about behavior change communication, which is within, it is encompassed within the bigger, you know, the bigger context of advocacy, communication, social mobilization, health promotion. And so we send out health messages which are supposed to be able to take care of the preventive, you know, the lifestyles that prevent these diseases. But over and above that, we are also aware that, you know, these are things that are cross-cutting. When I talk about mosquitoes, we cannot now say that as NTD program we want to go and conduct vector management activities alone. You know, even for many of the entities we cannot do them alone. So we have to now bring it to the element of coordination. One of actually the biggest, the reason why NTD programs were formed by WHO was to provide a platform on which the various players can contribute towards these interventions that I've talked about. So you'll find as malaria program is providing nets, I gave that example, our people benefit from that. As another program is providing interventions, like for example the health promotion unit, when the cholera people are providing health education against you know, polluting the rivers or you know, defecating openly. You know, entities benefit from that. So what we want to do as the water, you know, agriculture, Ministry of Agriculture, as they are providing water for irrigation, you know, in communities, it will not stop the community members from washing their faces using the water.
It's true that.
And in that way, trachoma is taken care of. So you'll find there are many small existing interventions that have not been put together, which if we put a good platform of integration and coordination, already we can achieve up to more than 70% of what we want to achieve without even putting in any resource. So generally, yes, we are looking at augmenting whatever preventive interventions that are already in place, but at the same time we want to identify the gaps, the existing gaps that are not being taken care of, so that as a program we can now provide deliberate we can now have a deliberate attempt to address those gaps.
Now, Bwana James, as we wind up for your last remarks, do you think now devolution is making this better? Of course, from the ministry's angle, there's a national overview over there. There's a national overview over there. Of course, devolution now to the county governments. Do you think now the county governments are also doing much more to make sure these things are actually managed?
Yeah, I think so. There's a lot. We have, for example, as Kenya Red Cross engaged multiple counties. I think we have understanding and, I mean, agreements with more than 20 counties now. And particularly in the area of health, I would say that devolution is supporting the agenda that Dr. is explaining on at that level. In the sense that in the agreements that we have with the counties, for example, being in Tharaka Nithi, and where we have unveiled the Kenya Red Cross supported and trained community health workers, the agreement is to ensure that the county government is able to support and to sustain the stipends for the CHVs, and also ensure that as a partner, we come in to equip, train, and give the capacity to the CHVs to be able to do those functions at primal healthcare level. Do the referrals, do the education, do the promotion, pass the messages, and handle the BCC that Dr. is talking about. So there's a lot taking place, and I think devolving the component of WASH or water sanitation is a fully devolved function. So it's the counties that take charge of this, and it moves closer to the community. So supporting that structure there of community health strategy will ensure that actually the counties also in turn strengthen the process of community taking up the challenge of health to their own and solving issues. So it's working, and we hope that even with the perceived or the effort to ensure that more resources are needed at that level, this is an area that has to be given more concern, and we don't want, for example, the aspect of primary health care to also get to be neglected, because we know its contribution to universal health coverage, and it's been showcased, and we have something to share from the counties that actually we have engaged on this.
Thank you very much, and of course, Dr. Mutendechero, for coming to studio. I personally have learned a lot from this, and of course, hoping that maybe these things will actually be sorted soon, and I believe no Kenyan should actually just be affected by this, but good job you're doing. Good job also doing, James, and thank you so much for coming to the studio.
Thank you.
All right. You're now taking a short break. When you come back, Mr. Patrick Obel will actually be coming in to discuss more about now pressure in our society, especially pressure in our institutions. To be specific, learning institutions, all the way from USIU. All that after a short break.